Doctors of Reddit, what was the dumbest I read on the internet? Moment you had with a patient? When I was a medical student I met a woman who was heavily interested in homeopathy and natural healing, who started drinking her own urine. You can often drink small amounts with no issue, but she was drinking only urine. Urine has a high salt concentration, and she ended up dehydrated with an acute kidney injury. I want to see the face of that kidney. My job is to get rid of that stuff. Why would you bring it back? My father saw a patient who was convinced that hospitals were a sham. She had cancer. She winds up on chemo for a bit but very quickly tells my father she isn't going to be taking her medication anymore because she knows when she's being scammed and the side effects of her medication were proof. Apparently, the chemo my father was prescribing was a ploy by Big Pharma. Apparently, that was what was actually causing the cancer in the first place. Well, she decides to go off her medication for a bit and starts feeling better as no chemo equals no side effects from chemo. She takes this as further proof that hospitals are a sham and starts blogging about it, posting online about how she's living proof that hospitals are fraudulent and telling people to stop buying Big Pharma's lies. She was then sent back to my father via ambulance sometime later. The test results were back and, surprise surprise, stage 4 cancer. She died in the hospital later that week. I'm not a doctor, but I did take my very elderly nana to the hospital after I showed up to her house and found her slurring her words and behaving very strange overall. Now, my nana is a major hypochondriac, and when she was admitted the first thing she told the doctor is that she believed she was experiencing the beginning signs of Parkinson's. It turned out that she had mixed up a bottle of non-alcoholic wine with a bottle of regular wine, had drank the entire bottle, and was completely hammered. I regularly have to explain to junior detectives and families that an autopsy does not function as it does on CSI, and I can't just speculate wildly about the sex, height, hand dominance and motive of a murderer, except in very specific instances. But I don't blame them, I blame fucking CSI. You'd be amazed at how many people tell me, type 1 diabetic, that I could get out from Big Pharma and my dependency on insulin if I just eat right. I'm skinny and otherwise healthy. Type 1 is an immunodeficiency that must always take insulin due to the pancreas no longer creating any on its own. These conversations are often met with a blank stare by me. Diabetic also. Man I hear ya. Did you know a cup of blueberries a day cures it? /s. My dad is a no document. One of my favorite recent stories is of the teen girl with blue legs. Teen girl and her mom had been waiting at the ER for 6 hours when he came on shift. He read the chart before he came into the room that she had blue legs and was otherwise normal. When he looked at her he didn't see blue around her mouth etc. that would indicate lack of oxygen and her levels were normal. Just bright blue legs. He goes over to her with an alcohol swab and wipes some of the blue off her leg. Then asks her if she just bought new jeans. Mom and daughter look at each other and burst out laughing, realizing they waited 6 hours in the ER for nothing. He said they had a good sense of humor about it and could see how ridiculous it all was. Nice funny story that balances out all the crap and sad stuff he's seen over the years. Edit. Typo. Not a doctor. As a transplant recipient, I have to take immunosuppressant medication for the rest of my life. There are studies that some people do come off them completely, but it's such a huge risk to take that it may trigger organ rejection. A family member of mine still can't grasp how life-saving surgery, provided by Western medicine which initially saved my life, is still keeping me back from living my life. He suggested that I get off my immune suppressants because I'm a cash cow for Big Pharma. Not a doc, nurse, but my doctor friend who works in the ER had a patient with a few garlic cloves stuck deep in her vagina because she had read on the internet it helps with certain infections and yeast. I realize garlic does have antibacterial properties, but needs to be used appropriately and with caution. I had a friend about 10 years ago go to a faith healer for wrist pain from drumming and ask me to go with him. It was the dumbest shit I have ever seen. He paid her £200 to literally just wave her hands over his wrist for 20 minutes while some panpipe music played. Funnily enough, it didn't cure his carpal tunnel syndrome. Who would have thought? It did make me wonder whether I'm missing out on an easy scam if people are that gullible. Though XD. There was supposedly a guy who suffered from back pain. At a conference, a spiritual healer offered to treat him. He woke up the next day without back pain for the first time in years. However, he had turned down the treatment. It was a coincidence. He said that if he had accepted and still randomly gotten better, he would be honestly and truthfully evangelizing the treatment right now, and it would be hard to blame him. As a general surgery resident on the colorectal surgery service, we do a lot of hemorrhoids, anal fissures, etc. One of my colleagues prescribed a cream for a middle-aged woman and she later called back and asked if the cream would still work while she was on vacation in Hawaii. Yes it will. Why? She replied, BC I was told to apply it locally. I'm an RN. Patient W/diabetic foot ulcers read on the internet that salt would dry them up. He put his foot in 2 plastic shopping bags W/rock salt and turned his foot into prosciutto basically. Had to carve/amputate most of his foot. He has forever been nicknamed Hammy by me. Conversation I had with a doctor a few days ago. So I was told that if I can identify what food I'm eating that is giving me gout I can avoid it and won't have as many flare-ups. Is that right? Doctor literally laughs out loud. No. Evidence for dietary based management of gout is very sketchy at best. Take the pills. Where did you even hear that? Your nurse said it to me. I suffer from gout. I was diagnosed with it last summer and had to go through various combinations of pills to work out strength and dose I needed to manage it. Anyway, my mum tried telling me it was because I drank too much beer. I ate too much red meat. All stuff she'd googled. Doctor told me that they don't fully know the cause and that he knows professional athletes that have struggled with it. I'm not saying I'm a professional athlete, but it made me better knowing it can be literally anybody. On the downside, the bouts I have had have been some of the worst, most consistent pain I have ever endured. I literally wanted to chop my foot off to stop it. I wouldn't wish it on anyone. Gout is horrific. My grandpa, this is before internet, heard through grapevine that putting warm oil plus garlic combo in ear can make ear squeaky clean. He put hot oil plus garlic in ear and had the habit of cleaning with toothpick. Now he has no eardrum in one ear and partial hearing in another. This was before internet. It was the quack therapy. People still give this kind of advice with guarantee. His personality has changed completely. I think he mixed up the ear cleaning routine with a recipe for garlic bread. Recently 5-year-old boy brought in by mum with a sore ear. Diagnosed with an ear otitis media infection, given back pocket antibiotics to start if getting worse or ongoing in another 36 hours, as they often go away on their own. Mum declined, is going to take the kid to an HROpath for treatment instead. Unlikely to have a poor outcome, but still possible. But why the fuck did you come and see me? Not a doctor, but I have had an instance where somebody told me something stupid that they read on the internet. A couple of years ago, I was dealing with some mild back pain. I texted a friend about it, and after 30 seconds she replies telling me that I have spine cancer. After telling her that there was no way that I had spine cancer, she continued to insist that she was correct and that her mom was a doctor, so she knew these things. SMH. AHH. Yes, the diagnosis via text. How's your spine cancer doing? The spine cancer disappeared after 2 days, so I must have hurt my back slouching in my chair or something. Best friend is a doctor and someone came into her because they couldn't get an erection. So this is the year we are gonna have to refer you to outpatient care. Miss us, don't you understand? I have someone waiting at my house. I'm just an accountant. Once I talked with a diabetic who read on the internet that cinnamon controlled blood sugar, so he stopped taking his medication and relied on cinnamon instead. It cost him his big toe, which he lost to diabetic amputation. I'm not in the medical field, but during my time as a student with acquaintances in the medical field, 2 stories mark me. A woman kept getting pregnant within months of delivering the last baby, so her physician told her to take the pill. She comes back pregnant. The physician asks, "But didn't you take the pills?" "Yes, I added them to the food before serving the whole family." Another one was a woman who came with a baby suffering from a weird skin condition on his buttocks. After leaving no stone unturned, the clueless intern asks her to show how she takes care of the baby. "Let's start by changing diapers." That's when the mother asks for a glass of water to pour it in the diaper, like they show on TV ads, before fitting the diaper on the baby. Not a doctor, but a relative of a doctor. One set of distant cousins live across the street from us, and they know my sister is a doctor. 2 members of that household got diagnosed with some form of cancer, my cousin's wife, and one of the people she employed in her business. Business was set up in her home. Both of them consulted with my sister. Note, oncology is not her specialty, but she's got a good network of fellow doctors whom she could refer people to, who advise them to see an oncologist that she knows. Our cousin's wife decided that that was too expensive and went on some kind of holistic/herbal medical route, despite my sister's warnings. The employee wanted to see the oncologist, but she was worried that she could not afford it. She also had a family to support, and she was scared to leave them. My sister managed to get the employee to her oncologist friend and get her the treatment she needed and have the expenses paid. Not sure if she paid out of pocket or allied somewhere for financial support, but the help was given, and I'm so proud of my sister. The employee survived. Our cousin's wife passed away almost a year later. Not a doctor, but I had a therapist for a short time who seemed to be getting her info from dubious sources. I described to her that when I was stressed out, I sometimes had times when I would wake up. After analyzing my surroundings, these situations seemed to only happen after a span of a few seconds or minutes. She insisted I had dissociative identity disorder. I told her I never had an issue with another personality or anything, and she said that I didn't need to have a separate personality to have dissociative identity disorder. Turns out it was absence seizures. I was having absence seizures that lasted a few seconds, caused by both stress and caffeine, which I had been drinking every day. A friend/pharmacist told me a story about a 17-year-old female patient who came in with her boyfriend to pick up birth control for the first time. They got a 28-day supply and had no questions, but returned 2 weeks later saying they ran out. The girl said she read on Facebook that if you both take the pill once a day, it's twice as effective because it gets into the guy's semen. My friend said it was a long conversation explaining why that doesn't make sense. We need better sex ed in the US, lol. Literally in the elevator the other day, I had a woman look straight at my badge and then tell me, "You know, these blue hospital masks are only good for 30 seconds, right? After that might as well not be wearing one." I honestly didn't know how to respond.